What's up, guys? Dr. Donald.
Dr. Ben.
That's when you say your name. Okay, so we're going to talk a little bit about pain and soreness, pain versus soreness. And when you go throughout this program, I think this is a very important topic because you may feel some soreness, and we want to teach you how to distinguish between the two. This guy's way more buff than I am, so he knows a lot more about soreness than I do, so he's going to take it away.
So here's what I think I want you to take away from this is, for some of you guys, this program that we're putting out, which we like to think is like a daily hygiene or a pain management program, can be exercise. Many of you guys are very fearful of moving and are worried that you're going to break or that you potentially will make your situation much worse, and you don't know what exercises to add. So because of this, your body will become very deconditioned. And when you first start our program, you may experience some discomfort. And that you really do need to figure out, is this soreness because I'm using my muscles in a way that I haven't? Or is this pain? And here's one really good way to kind of determine the difference between the two, because soreness does feel like a form of pain. There's a phenomenon called DOMS, which is delayed
Onset muscle soreness?
Yep. Delayed onset muscle soreness. And essentially what they think is going on is you did some movements, you're not used to doing those movements. We create little tiny microscopic little tears in the muscle fibers. And these little tiny tears are actually really good because they start off a inflammatory process. So not all inflammation is bad, which begins the healing of this tissue. And all these chemical mediators and things coming over to heal it is what's going to help make you better.
And stronger.
And stronger and more resilient. And this is how all muscle is built. We create micro tears, they grow back, and sometimes those micro tears can be really, really irritating. Usually this phenomenon lasts, I don't know, for 72 hours max. You'll feel it within the first 24 to 72 hours. And it gets better the more you get used to doing this. You get much less of that micro tearing going on, and the program should feel good. Now there's a small percentage of you that are doing this pain management program that are actually going to experience this, but I want you to be aware of it. Sure. And I don't want you to be afraid of it. Pain, however, is an exacerbation of the symptoms that you've been feeling. So that's what this is. And another thing too I want you to associate with pain is if you start to get long track symptoms. And what do I mean by that is if you have pain in your back, and like let's say it's in your low back in one area, and it starts to diffusely go down your leg, down into your hip, down into your calf, or cross over and go down into the other leg. This is a sign that you are experiencing pain, and this could be a bigger symptom.
Sure, and at this point, I would consult with a local physician that is equipped to handle your scenario.
Yeah. So that would be a chiropractor, that could be a physical therapist, that could be a orthopedist, but make sure you get help and make sure you get the right help.
Sure. So in general, that's all we got.
So in general, what are we talking about?
Right? I think that's it. I mean,
yeah,
you explained it beautifully. It's really the difference between pain and soreness is, I think the main thing is knowing that if it reproduces your back symptoms or the symptoms that you've been feeling in general, that's probably not soreness. And soreness oftentimes gets better as you move too. I think that's an important thing.
Yeah.
Like the movement often makes those muscles feel a lot better. And that's good feedback. And when that would be muscle soreness versus maybe a joint or something that you're worried about hurting. And at the end of the day, you are less fragile than you think. And you are much, much stronger and much more resilient than you give yourself credit for. So stick with it. Unless you have those symptoms that Dr. Ben was talking about before. So that kind of wraps up our segment on pain versus soreness.
One more thing about,
unless you have something else to say.
I do. One more thing about pain that I want everybody to realize is If you are doing this exercise program and at some point you do flare up and you've had chronic back pain for a really, really long time, that doesn't mean you need to abandon the program. That doesn't even necessarily mean the program flared you up. Because if you've been prone to flare-ups before, you could be experiencing that. And it's okay to try to work through the program a little bit if you feel safe doing it. If not, go see somebody right away, get some help.
Yeah.
But you may not be abandoning this program forever. You just may need some acute treatment.
Sure.
And then you'll be able to get back on track. And this is still a solution that can work for you.
Absolutely.
Low back pain is extremely complicated, and be patient with it. We're looking for you guys to not necessarily have all your pain go away. We just want to get you feeling
Absolutely.
better.
We want you to be able to do the things you love to do in an active lifestyle, and our job is to guide you through this process, not fix you. You are the superstar here. We are just the coach. Perfect.
Perfect.
All right, guys. Keep an eye out for our next stuff. I don't know what it is yet, but we're going to have it. If you have suggestions, we're open to it.
Yeah.